first test we're going to be doing is called the cervical compression test. This test is going to test for cervical radiculopathy. So you're going to want your patient to sit up nice and tall. So what I'm going to do is I'm going to apply force to the top of your head. I just want you to let me know if you experience any pain or any reproduction of any symptoms that you might be having.
No pain.
So a positive test would be if the patient experiences an increase in pain or if they have any reproduction of symptoms. Commonly seen symptoms would be numbness or tingling down the arm with cervical radiculopathy. And all I did was go in and apply an axial loading force to the cervical spine through the top of the head. The next test that we're going to do, can I have you scoot forward, feet flat on the floor for me? This test is called the Roos test. This is going to test for thoracic outlet syndrome. So what you're going to have your patient do, can I have you bring your arms up to here and have you, and I just need you to rapidly open and close your hands. So you're going to have the patient do this for a minute. So the patient is in 90 degrees of flexion, 90 degrees of abduction, and externally rotated. Sit up nice and tall while you're doing it. So all you're looking for here is a reproduction of symptoms. Typically they'll see the numbness and tingling going down into the arms and the hands. All right, and you can stop. Did you have any increase in symptoms with that? Okay. So the next test that I'm going to do is called a modified sharp pursers test. This is to test for cervical instability. So what I'm going to do is I'm going to I'm going to find C2 vertebrae. I need you to sit up nice and tall for me, shoulders back. Yep, C2 vertebrae. That is going to be the first vertebrae that you'll feel. Typically it's just below the occipital protuberance. I'm going to come once I find it and do, it's called a pincer grip on either side of the vertebrae, and you're going to have the patient slightly flexed, and all you're going to do is you're going to come in and I'm going to apply an A to P force at the forehead a few times. And relax. And what you're feeling for in that test is excessive translation during the A to P force, or any increase in pain when they go into neck flexion. All right, and lay down on your back for me. This next test is test for nerve tension. So I'm going to be testing for ulnar nerve tension today. So each step of the way of this test, I'm going to be asking the patient if they're experiencing any signs or symptoms with every new motion that I introduce. So first things first, I'm going to come in, I'm going to depress the scapula. Any signs or symptoms, any numbness, tingling? Okay, I'm going to bring them into 90 degrees of abduction. Any signs or symptoms? I'm going to maximally externally rotate. Signs or symptoms? I'm going to come in and flex the fingers and thumb and extend the fingers and thumb and wrist. Any signs or symptoms? And then I'm going to slowly extend the elbow. Any signs or symptoms there?
A little pain.
All right. So for this, since he's experiencing a little pain in this motion, I would kind of just work in this motion here. I could also ask him to turn his head towards the left while I'm doing this, just to get a little bit more of a stretch throughout there. All right. And the next test I'm going to be doing, or manipulation I'm going to do, is a manipulation of the cervical spine. So can I have you scoot all the way back off of the table and have your head in my hands? So before performing any type of manipulation, you always need to do a vertebral artery check to make sure that it's intact. So all you're going to have your patient do, nice and relaxed, open your eyes for me. You're going to take their head back, extend it down. You're looking for nystagmus in the pupils. Are you experiencing any nausea, dizziness, anything like that? Nope. So you're just gonna hold this for anywhere from 20 to 30 seconds. You'll take them back out, relax, rotate to one side, extend them down. You can all open those eyes for me. You can also do this in a seated position, have them extend and rotate, and that's known as Wallenberg's sign. And rotate to the other side and down. Any dizziness, nauseous, numbness, tingling, anything with any of this? No. And you can go ahead and scoot back to where your head is on the table. So I won't be performing the actual manipulation in this video, but if you were to perform the actual manipulation, you always need to make sure you get consent from your patient before performing it. Also make sure you inform your patient that if they experience an increase in dizziness, blurred vision, nauseous, vomiting, anything like that after having a performed manipulation done on them within 24 hours, that they need to seek medical attention. So to set a patient up for this manipulation, you're going to come in, you're going to make sure they're nice and relaxed. Typically before you perform a manipulation, try to get the patient to relax some. A lot of patients have a lot of anxiousness before they get a manipulation done. You come in, you can do a little massage on the neck muscles just to get them nice and relaxed. Once you've done that, you're going to come in, and for this I want to be on the C5 vertebra. So I'm going to come in, I'm going to find C2 and work my way down to C5. Once I find the C5 spinous process, I'm going to come about a finger width off of that spinous process, and for this I'm using this part of my finger with all the movements that I'm going to be performing. So find that C5 again, come a finger width off, and that puts me at the facet joint. So once I'm on that facet joint, I'm going to rotate them 45 degrees and a little side bend. I'm going to come in with that index finger. I'm going to apply a P to A force and a lateral shift. So I'm going to make sure that I get that facet all the way locked out, and then I can perform the thrust along with that to try to get a cavitation. And then the last thing we're going to be performing today, can I have you roll over onto your stomach for me, is a central P to A glide and extension. So you want your patient to have their chin on the table so that their neck is an extension. So I would come in and just start feeling for their spinous process. So there's C2. So you can work your way down on top of the spinous process. If they have any pain at a specific spinous process, you could start your work there, or you could just start at the top and work your way down as well. I'll start at C3. So I'm going to come, I'm on the C3 spinous process. I'm going to come and do a thumb over thumb. I'm going to just apply a little bit of a P to A force. Right now I'm doing about a grade 2. Grades 1 and 2 for mobilizations are used to decrease pain, and then grades 3 and 4 are used for increasing range of motion. So I'm just doing a grade 2 right now, taking up my tissue slack, doing nice little oscillations just to about 50% of the movement and back out. And you would just work your way down the spinous process, or you could focus on a certain one. You can go ahead and sit back up. After you do this, you would have the patient sit back up, reassess range of motion in all planes, ask if they have a decrease in pain, and see if what you're doing is working.